important community group that makes a huge difference in the lives of our residents in the state. I've been out to their facility, and if you haven't been, you need to go. It's not just about helping individuals maintain their dignity when they're dying or when they're ill, but for a large part in a population, our senior population, where oftentimes either as a result of stroke or other disabling conditions, it's the single largest population of disabilities in this country. And many times we're not ready to give up. It's time that the kind of organizations like the Senior Resource Center that empowers families and individuals to actually have a decent quality of life and feel like they're still part of their families and part of their communities. And in living a good life and feeling good about what you're able to do, then you can end your life with dignity and know that there are options. And that's the wonderful part about the Senior Resource Center, is they preserve your options. And now we're going to have to look at how we commingle the delivery system of health care with organizations like the Senior Resource Center so that we can help each other maintain that high quality of life and the high quality and dignity in dying. And as we go through looking at how we're going to reform our health care at tough economic times, I think it's critical that we all come together. I know Senator Boyd and I have worked on several pieces of legislation together that will make it easier. Remove the barriers that will keep people in their homes, make it more efficient and cost effective by making sure we have opportunities for health care, particularly primary care. In my case, I'm writing a bill this year to put primary care all over the state. It'll be a lot easier to get families the care they need in their homes when there's care available in their communities. And when we can make sure that everyone has access to insurance, be it public, private, whatever, then we also create more options for families to get the care they need. And that's what we are, as policymakers, are empowered and charged with here, is how do we take a decreasing resource base and stretch it to meet what I think are primary essential services for families, making sure families can stay healthy. So it's a great honor to be here with all these experts in the field. And if you look at the people that you'll be talking with today and hear their presentations, you will not only realize how valuable this organization and all these individuals are to the state of Colorado, but commingle that with the fact that Colorado has one of the most advanced health care opportunities in the country. We have tremendous facilities here. We have some of the best facilities in the country, right? Here in our backyard, Fitzsimmons, Swedish campus, there are all kinds of campuses. El Paso County has a great medical campus down there. Grand Junction has a wonderful model for the delivery of the public-private partnership. So we're rich in healthcare opportunities. And from a public policy level, it will be our charge to maximize our capability and utilization of those resources. So I want to introduce to you Jayla Sanchez-Warren, who's been with the DRCOG for 21 years. She's managed the Ombudsman program since 1989 and is credited with creating the program's volunteer corps. She's worked for 15 years on state and federal legislation, which right now couldn't be more valuable to have that expertise as we are challenged to deal with not only the type of legislation that's being crafted in Washington, but what we do at the state and how we are going to balance all of that. Governor Ritter appointed Jayla to the Board of Commissioners of State and Veterans Nursing Homes to study the problems of health care with our Colorado veterans. We currently have seen her recommendations go to the Department of Military and Veteran Affairs, identifying programs that are needed to provide those services.
Thanks. So now I'm the director